because there's no income that's demonstrable.
Listen to the story that happened last night. This happens every day.
This happens every day to us. Last night, I was called from the emergency room. There's a patient there, 24 years old, doesn't speak English, from Mexico, had a child 3 months ago at our hospital, 6 months ago at our hospital. Now, she received prenatal care for free, had her baby there for free, has had, baby care there for free, and now she has an inflamed gallbladder, and she's waiting for the gastroenterologist to take a stone out of her common bile duct, which is a complicated thing, and she's then waiting for me to take her gallbladder out. Now, where do we come to the point in our society where we have to say, you're here in a time of need, we're going to take care of you. Now that you're well enough, here's your ticket and go back home, because this is draining our society. And the fact that then now we see the interpretation of the 14th Amendment is that they have an anchor here is totally wrong.
That's true. The 14th Amendment was actually designed to give slaves the right to vote and to eliminate any question that a freed slave was actually a U.S. citizen. The unintended consequence of that, or interpretation of that, has been that any person born here in the United States is a United States citizen. That's actually a misinterpretation, because you must first be under the jurisdiction of the United States. And a person who has entered the country illegally technically is not under the jurisdiction of the United States, I would submit. So we may not even have to change the 14th Amendment in order to, perhaps by legislation, define what United States jurisdiction is for the purposes of citizenship. I mean, we might be able to do that by a legislative definition.
But either way,
right.
These people, they do care for all these people.
Right.
And how are we going to stop this?
Out of compassion, we do care.
You don't have a choice once they're in your hospital or in your office. You must do what you must do. You have the Hippocratic Oath, and and you certainly don't. You don't want to have it on your conscience that somebody came to you, you had the ability to help them, and now they're either sicker or dead. You can't do that. But what we can do to help you with this problem is actually enforce the immigration laws that the people of the United States have promulgated through their representatives in Congress. I'm here to tell you, as an expert on the immigration law for those 20 years that I referenced, that the law as written, if it is enforced as written, is extremely effective. Any progressive telling you that that law is broken and does not work did not agree with it in the first place and is trying to manipulate a change. What we need to do is we need to document those who are here and process them. That means that anyone who has crossed the border without permission, or has overstayed a temporary visa, or is otherwise out of status, needs to be processed through an Immigration and Customs Enforcement office. Criminal aliens will likely be detained in a jail, but a non-criminal alien, the only law they've seemed to have broken is the one coming into the country or overstaying the visa, will probably be processed on an order of supervision. So this myth that everybody's going to be in handcuffs, it doesn't have to be like that. And actually, by processing an immigrant through an order of supervision and putting them through the immigration court, they become eligible for defenses they can't get without going to the court. So many immigrants who are hiding are actually hurting themselves and their children, because they're leaving their family at risk of a great trauma if they're picked up and processed and deported, when they might be eligible for some defense to removal, which they can only get by going through the court system. I submit that in this economy, we have the opportunity to fix this mess. When the economy depends upon a certain type of worker, and the Department of Labor perhaps isn't caught up with defining what's in need and what's not in need, then the illegal employment of these people becomes problematic because the economy depends on it. In this economy, there are so many Americans out of work. This is when we need to fix this. Now, frankly, on the immigration issue, we also have to stop them from coming in. Because even if we send people home, if they keep coming in, you're still going to have people sitting in the hospital on charity care or sitting in your office sick, and you're helping them without being paid. So we can't allow that to happen. So we're going to have to secure the border at the same time. But, I don't want to get too much into immigration. I know we're here to talk about healthcare, but there is an overlap.
Definitely, and we see it. The cost is astronomical.
Right.
Just to get back to primary cares, and one issue that always comes up is tort reform or malpractice reform.
And I'm an attorney willing to do it.
And and most attorneys, and I always hear this, that the attorneys lobby spends tremendous amounts of money giving to, whether we say given or paying off the federal government, not to discuss tort reform or malpractice reform. Now, as a physician, and I think 90% of the physicians you talk to, maybe more, will say that it's a real serious problem. Primary care doctors starting, anybody starting. And I can't understand why we cannot develop a system like in Texas. 2003, they had Proposition 12. They passed Proposition 12 in Texas. Premiums have gone down for physicians over 27%. The biggest influx of new doctors going to a state is Texas. Mm-hmm. And a majority of hospitals paid a good percentage of their charity care from the savings from these malpractice costs. So why, in heaven's name, can we not get something started in New Jersey or across the country and stop this malpractice crisis?
I believe we can, and I believe we should.
What?
My efforts as a congresswoman, because I would be at the federal level, winning the election on November 2nd of 2010, 41 days to go. As a congresswoman, I would be able to propose limits on recovery available, and let's say severe consequences for frivolous lawsuits that would act as a deterrent. My litmus would be, and as an attorney and a litigator, I completely understand what I'm talking about, my litmus would be out of pocket, perhaps lost wages. But see, it's the pain and suffering issue that gets you these astronomical amounts. There needs to be a ceiling on that. The loss of society with a husband or a wife, the relationship issues, they get out of control. Those things need to be capped. And frankly, if we set that kind of a system up with ceilings on those judgments, people aren't going to look at it as a way of making money. They're only going to do it, especially if there's a detriment, a huge penalty that's a detriment to doing it frivolously. They're only going to do it if they really have a claim. And, it may take a little bit of enforcement on that frivolous end to kind of change the tide of things. As for my brethren, the attorneys, there's always going to be a lot of work for attorneys. We're never going out of business. The question is, will you be working in this area or in that? There's always something to do.
Wouldn't it be easy to get a panel, like an attorney, some judges, some physicians, and look at every lawsuit, medical malpractice suit that comes out, and look at it for its merits, and then decide whether it should go forward or not?
Yeah, I think there should be. In New Jersey, there are some standards that have helped us with medical malpractice, in that you do need to put a certification within a certain period of time. You can file your complaint with one. If it's insufficient, you can amend it up to a certain period of time, or your complaint is dismissed. So those kinds of benchmarks help. The problem is when certain doctors are willing to put themselves forward as stating there's a claim when perhaps there shouldn't be.
For a fee.
Right. So that's why I believe the ceiling on the judgment is really the better way to control it, okay? Because in that sense, the incentive is not as great. You're talking about multi-million dollars.
Even though the number of cases that are won are few.
Sure.